Can you imagine suffering from a disease that affects your everyday and never going to see a doctor for help? Despite the pain you're in, the clothes that are ruined, and your confidence being worn down every day. Well, that is often the case for people who suffer from hidradenitis suppurativa. Today I will inform you about the skin condition known as hidradenitis suppurativa, also known as HS. I have been living with mild HS since I was 9 and was officially diagnosed at 17. Since my diagnosis, I have been doing extensive research to learn more about this mysterious skin condition. The information I will discuss with you here today is important because, according to Medical News Today, hidradenitis suppurativa affects at least 1% of the population, if not more, because it is a highly underdiagnosed condition. You or someone you know may be suffering from HS and or at a loss for what to do for treatment. The information given to you today will be the start to your HS awareness. Today in my speech, I will discuss what hidradenitis suppurativa is, who suffers from hidradenitis suppurativa, and the treatability of HS. Information about HS is continuously changing due to new research being discovered every day. Hidradenitis suppurativa is defined as a chronic inflammatory condition where an overactive immune system contributes to inflammation below the skin surface. This is according to a web source titled No BS About HS, which is sponsored by the medical prescription group Abbevie. HS has many symptoms that make it easy to identify. The most commonly affected areas involve locations where skin touches skin on the body, specifically in the armpits, the thighs, and the groin area. There are also different levels to how severe a patient's HS is, depending on the frequency of breakouts. The different levels are mild, moderate, and severe. HS looks like a breakout of pimples or boils. The American Academy of Dermatology outlines the symptoms as follows: a hard lump under the skin, an area of the body that may be tender and have deep swelling under the skin, large and painful wounds that heal very slowly, if at all, and major crater-like scarring from the area getting repeated breakouts. After being able to identify HS, it is important to know who is more likely to get it. With HS being an underdiagnosed, the actual demographic is subject to change, and as more research is done into the disease. Hidradenitis suppurativa, which is a mouthful to say, can affect anyone. However, there are certain characteristics that a person who is more likely to suffer can have. These factors are important to know because it helps with diagnosis as well as research. An Australian academic study about the prevalence and demographics of hidradenitis suppurativa had a population of 12,000 participants, with varying levels of HS severity, age, and length of time before and after diagnosis. These are just some statistics from that study. 67% of that population study was female. The average age range of the participants were 32 to 44 upon diagnosis. 53.8% had experienced symptoms for more than 10 years. Many people who suffered from more prevalent forms of HS happen to be overweight and obese. There is also a strong connection between HS and the belief that it is hereditary. HS can affect anyone. However, these factors in the study that was discussed show the current statistics of the people who have officially been medically diagnosed. It is also important to discuss what HS is not, misconceptions about the people who have it, and the public perception of the disease. The only key factor on this list is that HS is not contagious. No one has ever contracted HS by having skin-to-skin contact with someone who has it. Now that I have discussed the people who are more likely to suffer from HS, I will explain the options for treatment. There are many treatment options for those who suffer from HS. There are home remedies, prescription treatments, and surgeries. The Journal of Clinical and Aesthetic Dermatology published an academic journal detailing surgeries that are often needed for more severe cases of hidradenitis suppurativa and its side effects. Surgeries can also be optional aesthetic procedure to help the self-confidence of a person who is in remission with HS. Surgeries include incision and drainage, CO2 laser therapy that helps lessen scars and prevents more breakouts from occurring over time, recovery or reconstructive surgery that is also to lessen scars and the breakouts that the breakouts can leave. While there are too many medical prescriptions to list and describe, they usually fall under 5 types that are named by the Medical News Today article. There are topical or oral antibiotics. There are topical or oral retinoids, which are typically used for acne. Hormonal medications like birth control. Biological agents, which are medications made with living cells like Humira. And corticosteroid steroid injections. Home remedies are really what most people use when they are treating breakouts at home. While I'm sure there are a lot of helpful home remedies for HS, I will only be listing a few in this speech. The first being applying a warm compress to places that are breaking out. Usually the warmth allows the skin to not feel as tight around the area that hurts. Limiting scented and chemical-dense soaps when bathing to avoid flare-ups. And not scrubbing the areas with anything abrasive when bathing so it doesn't rip open the breakout or it doesn't get infected from the bacteria on the rag or loofah. And also applying aloe vera to soothe the skin and keep it moisturized. It is important to say that there is no current cures for HS. It is a lifelong disease and can only ever be treated. In conclusion, hidradenitis suppurativa is a complicated skin condition that doesn't get diagnosed nearly enough and is often a disorder that people live with for years before seeking treatment. In my speech, I shared with you that hidradenitis suppurativa is an autoinflammatory disease that causes skin breakouts. I discussed the demographic of people who are most likely to get diagnosed with HS and how those people get relief from the debilitating condition. This speech was to bring awareness to the disease that is often suffered in silence. There is treatment available to those who get diagnosed, and with more people diagnosed, the more research will be put into finding a cure. Thank you all for giving me your time, and I hope you have a fantastic weekend.